genetic testing now. Do you think that's the way of the future of cancer treatment? Will it become more mainstream as perhaps it gets cheaper? Or, I mean, you can have one person on a treatment and another who ostensibly has the same cancer but does badly on exactly the same treatment. Do you think genetic testing makes the difference in that situation?
Yeah, genetic testing definitely is becoming more and more prevalent in not only breast cancer but all cancers. And there's two similar terms that get mixed also very often. One is genetic and the other is genomic testing. Genetic testing is what we call the testing of the blood for inheritable genes that could increase the risk of cancer. Those are the BRCA genes and several other genetic syndromes that can be passed to families and increase the risk of breast cancer or other cancers. Testing for those genes helps prevent putting people that are known to have the syndrome at a regular screening at earlier age, or even having preventative surgeries to reduce the risk of cancer coming. In addition to that, that also opens the options to new treatments. So some of the targeted treatments actually work by using that genetic abnormality as a cancer weakness. So, for example, the BRCA gene actually is a gene that helps cells repair their DNA. So every time when the DNA replicates and the cell divides, the BRCA genes and the PARP genes, those are the genes which we call homologous recombination genes. They run through the DNA and fix the errors, so they cut off all the wrong nucleotides and fix the genes so that the same information can be passed on. When someone has a mutation in one of those genes, those enzymes don't work well. So as the cells divide, there's going to be more and more errors, and that can bring on cancer. So once some of the critical genes in the cell that control the cell from becoming cancerous, when they become dysfunctional, then the cell can become cancerous and starts dividing uncontrollably. But at the same time, that cancerous cell will still have that repair gene abnormal, which makes them also die quicker. And then if we use particular drugs, which again attack the backup mechanisms for fixing DNA, the cells just can't divide because the DNA keeps breaking and the cells die off. So that's genetics. Genomics is testing the tumor tissue for the abnormal genes. So as the cancer cell develops, they're bound to have more errors because the mechanisms of self-control are broken, and the cancer cell can develop gene abnormalities which are not present in the normal cells. Again, having that abnormality in the cancer cell and not in the rest of the body could also be exploited as a weakness. There's a lot of hospitals, including PA, that are now doing these genomic testing more and more routinely. So on the biopsy samples, and then if we find one of the genes of interest that are abnormal, then there are potential clinical trials that are looking at new drugs. There are some standard therapies as well for the breast cancer that have these sort of genomic abnormalities. So there's a gene called PI3K that can be mutated, and it's a known resistant mechanism for hormone therapy. So a significant proportion of women that have hormone receptor positive cancer will stop responding to hormones because of tumors develop this gene abnormality. And there's a new class of drugs that can be used to target that particular resistant tumors. Unfortunately, it's not still available on PBS in Australia, but hopefully we'll see that happening as well. But there are several trials around Australia as well that are looking at these sort of mechanisms as well.